Find a career you love with Pickaway Ross Adult Education. Skilled trades careers are in high demand with no signs of slowing down. Pickaway Ross offers career training programs with expert instructors and hands-on learning tactics to create a variety of opportunities. Visit our website for more information.
Welcome, everyone, to another edition, a special edition of Litter Media Live. I'm your host, Mike Smith, and joining me today from Adena Health System, we have Dr. Shaheed Koury. He is the Chief Clinical Officer at Adena. We're going to be talking a lot about their emergency department today. Dr. Koury, welcome. Good to have you with us.
Great. Thank you. Happy to be here.
When did you come on board here in Chillicothe?
I came on board the first week of January, so I've been here a little over 5 months.
Okay. Specifically, what has been your mission in coming to Chillicothe as far as the emergency department is concerned?
So when I first came here, Jeff Graham, our CEO, said, Dr. Koury, you have 90 days to evaluate everything, visit everyone, do what you need to do, but I want the emergency department fixed tomorrow. And coming into this position, I am an emergency physician, so I have a little bit of history and background with that area. And the emergency department was really struggling with their metrics, their satisfaction, how the public perceived us, and we needed to change that.
So in your 90-day study of the health department, what was it that you saw that you knew immediately needed to improve on?
Well, when I interviewed here and we were taking the tour, we walked to the emergency department, and I counted about 18 to 20 people in the emergency department. And there should not be more than one or two in the emergency department waiting room. So I knew there was going to be some concerns right there. And then as I got here, start looking at the metrics from the last year, in every category, we were not doing well. The morale was low when I walked through the emergency department. People weren't excited to be there. They weren't proud of the care they were delivering. And it's almost like they just needed some new leadership to come in and kind of show them maybe a different way of doing things.
From a layman's point of view, if you can, help us to understand what it is that, you know, the things that we can see other than no long waiting periods. What is it that changes that makes that happen?
So behind the scenes, there's a lot that happens. So one is really putting in those best practices. I've been in over 200 emergency departments in my previous jobs, so I know what works and what doesn't work. You know, having someone up front when a patient comes in, if there's nowhere to put them into a room, go ahead and start the workup on that patient. We have what's called protocols. These are created by the nurses and the doctors. So if a person fits into that protocol, where they're having chest pain, abdominal pain, fever, there are labs they can order, medications they can give before the doctor or the advanced practice provider even sees the patient to get things going. And I think the patients appreciate that, and that was not happening here. There are also things like really team nursing, getting people in the right place, maximizing the beds that you have versus spreading out everybody all over the emergency department. So we did some of that as well. It really meant meeting with Neely Kennison. She's the system ED director, and I met with her every week for about 3 months in a row. And we walked the emergency department, looked at the processes, looked at things we changed, and the culture started to change. When I first came down there, all the nurses would run to the side in the docks, and they would avoid me. But then after a few weeks, they're like, oh, hey, Dr. Koury, we just did this, we did this, and hey, we got this great positive patient comment, and things like that. So you could start seeing the trend was changing. And the metrics showed it. Our improvements and our numbers have been phenomenal.
You may have already touched on this a little bit, but I want to come back to it. And I guess, unfortunately, I've had to go to emergency rooms in different parts of the nation, North Carolina, here locally, Columbus. And I'm going back in my thinking 30, 40 years where it seemed like you had to sit there, give them all the information before they would look at you. Has that changed at all?
Yeah, so that changed years ago with certain federal laws that you cannot really ask anyone about their personal financial insurance information until we do what's called a medical screening exam. So, and the other reason is patient satisfaction, right? There's competition out there from other competitors here. So we want that patient, if there's a room available, we want to put them straight into a room. And then we can register them as the nurse is getting the patient ready to be seen, as the doctor's coming in to see you. We can get all that information while we're doing that initial screening exam.
You mentioned the number of different emergency departments that you've overseen. Being in a rural community and yet so close to metropolitan areas like Columbus, what are some of the challenges that we have that maybe you wouldn't see or in an inner city?
That's a good question. I would say that the challenge is usually for a rural emergency department, or you don't have a lot of services available. So you have to transfer out a lot of people to a higher level of care. We're actually very fortunate here, which is one of the reasons I took this job. And you don't see too many communities of 20-some thousand people being able to do valve replacements, open heart surgeries, all the robotic surgery with the urology, with general surgery, the OBGYN services we provide. You just don't have all that available. So we really don't have to transfer out a lot of patients here. So in the same sense, though, that's a struggle because those physicians are usually do not live in this community. So the wait time's going to be a little bit longer for them to come in and see the patient, and you can run into issues like that. And the other thing would be probably our EMS. We struggle with times if you're in one of our outlying hospitals to get that patient to us, or if we need to transfer a patient from here to one of our smaller like rehab areas. We really have a tough time with that. And I think at some point we're going to need to look at investing in maybe Adena's transport system or ambulance system ourselves to kind of help with that.
And staying on that thought, because Adena has become a regional campus as far as their medical care, but you have clinics, smaller hospitals in some of the surrounding counties. So if someone has an emergency, an injury, trauma, whatever the case, do they go to those clinics or those smaller hospitals in their county, or do they come directly to the ER in Chillicothe?
Yeah, and that's going to depend. If you're a patient, we absolutely feel comfortable with you going to any of our outlying 3 emergency departments, whether it's Fayette, whether it's Greenfield, whether it's Pike. The same emergency department group staffs all of those emergency departments. Fayette has an independent one, but eventually we'll all bring them under the same umbrella. So the quality of care from an emergency physician, emergency nurse standpoint will be the same. What's going to happen, though, is if you have to have emergency surgery, if you're a trauma patient, if there's something they can't handle at that local hospital, then they're going to have to transfer either to Adena Regional here or to Cincinnati or to Columbus, depending if we have that service available or not, or if the patient wants to go to a different place. But yeah, we absolutely encourage everybody to go to their local emergency department first.
Some of the information that Jason sent us ahead of this interview dealt with the time factor. Do you want to address that just as to how much time has been cut off in that waiting period?
Sure. So in all of last year, we averaged about 40 to 45 minutes for when you walked into the emergency department for you to be seen by a doctor or a nurse practitioner or a physician assistant. We now have that number down consistently for 3 months in a row. We didn't want to do this interview until we had data for several months. So we have it down to 10 to 12 minutes.
Wow.
So, I mean, that's almost an 80% improvement of your wait time. So what's that mean? Well, if you're coming in with chest pain, or if you've got a 2-year-old who you don't know what's wrong with them and you're terrified as a parent, you're not waiting 40, 45 minutes out in the waiting room because you think someone doesn't care about your condition. You're brought back to a bed within 5 or 6 minutes, but the doctor is seeing you within 10 or 12 minutes. On average, there's always going to be exceptions. There's always going to be busier days than others, but on average, about 10 to 12 minutes.
Well, will that doctor that you initially see in the emergency department, will they stay with you as your physician as long as you're in the emergency department?
They will, but understand emergency physicians work either 8 or 12-hour shifts. So if you came in at 6 o'clock in the afternoon, for example, they may start your workup and see you and get things going, but there will usually be a shift change at 7 o'clock, so maybe a new physician will come in and see you. So if you come in right where they're changing shifts, you may see 2 physicians, and you also may see a nurse practitioner or a physician assistant as your primary caregiver, but understand in the background there's an emergency physician overseeing that care as well.
With any winning team, and this is a team effort, you've already acknowledged that, when you're winning, how do you keep winning? And in this specifics, what we're talking about with the response time, how do we keep winning this way?
It takes a while, right? Because how many times does an average person go to the emergency department? Once a year, once every 2 or 3 years. It's kind of unusual. So it's really about word of mouth. It's about our employees' families. Are they going to trust us to come here? And 2, it's about showing the results. So when we first set out to do this, I got a lot of resistance. We had to change out medical leadership. We had to convince our nursing leadership this was the right thing to do. We had to convince our management team it was the right thing to do. But once you start seeing those results, and those nurses and doctors now, it's a competition to who can do the best, you're seeing patients smile more, patient families are happier, you're giving them better care. All of that translates into a better work life for you as an emergency physician or an emergency nurse. And the other metric that I really am proud of and want to share, there's a metric called left without treatment. So imagine, these patients come in, they're seen initially, the workup may be started, they get frustrated, they're waiting too long, they're not getting any communication, and they just leave. They may tell us, they may not tell us. And that national number should be under 3.5%. We were averaging 5 to 6% of our patients for the last year were leaving without treatment. And that's just not acceptable. Those patients who leave, you can have missed appendicitis, missed heart attacks, missed strokes, things like that. We have taken that number down to under 1%, which is an incredible. Now, what does that mean? That means before we were having about 150 patients a month leave our emergency department before their treatment was completed. We have that down to about 15 or 20 a month, and we've done it for about 3 months in a row.
Wow. You mentioned word of mouth. I guess in a way it's kind of like a restaurant. If you have a bad experience, you tend not to want to go back there. So getting people used to the fact there's a new sheriff in town, so to speak. It's not maybe the experience that you had before. Try us again.
Yes, and it's going to take time. I mean, you're always going to hear stories where, and I heard one when I was playing the firefighter outing the other day, the golf outing. You're always going to hear stories, and it's disheartening, right? But if you look at our positive comments versus negative comments, those have completely flipped from 65% positive, 35% negative, to whereas before it was 65% negative, 35% positive. So it's going to take time. And if you look at patient satisfaction, if you're ever seen in an emergency department, you're going to get a satisfaction survey from a company called Press Ganey. In December, January, we were in the 2nd to 5th percentile for satisfaction of our doctors and our nurses. Now, that doesn't mean you're in the top.
Right.
That means there's 97% better than you, right? I think people sometimes don't understand that. We have moved that up to 18th and 25th percentile. That may not sound like a big deal, but that is an enormous jump in patient satisfaction. So that tells us the patients are seeing it, the families are seeing it. We have a lot more good stories than bad. You don't see negativity. When I go around in the emergency department now, again, I see families who are being cared for. I don't see anyone in the waiting room, maybe one. And I go down there about every other day. And that tells me we're doing the right thing. It's going to take time, though, for our community to trust us, to know that we're not going to, it's not a Band-Aid station. We can actually treat significantly complicated things here. And our numbers are better. Our numbers are very, very good from taking care of our physicians are very high-quality physicians. So just as good as you're going to see in Cincinnati and Columbus, and most times better. Well,
of course, we've been speaking mostly about the one-on-one scenarios, the individual patients that go in. But again, as we talked about at the beginning of our interview, because you're a regional campus, there are so many other things, and I think we saw one of these incidents maybe 2 or 3 years ago. It was almost like a mass casualty event because we have state prisons here nearby. We have major highway thoroughfares that go through here where you could have, unfortunately, like what we saw in Philadelphia the other day. Fortunately, there was no one injured, but that could have been a really bad scenario. And these are things that you have to prepare for that the average citizen doesn't even see you in your preparation. That's right. You have to be ready for it.
And the emergency medical director and the nursing director for our system and our hospitals always conduct these types of drills, disaster drills, whether it's a chemical spill, a toxicology issue, a terroristic threat, a mass shooting. We prepare for all of those things, and we work with our state disaster committees as well. But people do need to know in the background, absolutely, we are prepared for that if it comes in. We're able to mobilize our resources. I think COVID even showed that to some degree, where we had the mass command center ran out of here. But absolutely, there's a lot of work that goes behind the scenes that the public may not be aware of, but I want the public to know and be comfortable if that should happen, we are ready for that.
Yeah, well, obviously we hope and pray we never have to deal with that. Absolutely. But again, it's just like with our fire departments, our law enforcement, they're training all the time in case of the worst case scenario. Dr. Koury, as we close, anything that maybe you want to bring up that maybe I didn't ask a question concerning?
No, I think you covered everything. I would just say to the community of Chillicothe, I grew up in Northeast Kentucky. So even though I worked in Nashville for 12 years, I grew up in a town very similar to this. So I'm very passionate about rural health care, small communities, and I know how 1 or 2 bad experiences can really affect a whole health system and its reputation. And as a newcomer coming in here for 5 months, I see nothing but wonderful physicians and nurses. I see a majority of people here who care about the community, who want to help the community, and I want to make this the best emergency department in the region, and we're getting there. It's going to take a little more time, but we're getting there. And I would say to anyone who questions that, please give us another shot and come in.
Very good. Again, obviously this is something that's been in the news over the years, but as Dr. Koury said, we're trying to get better, and we have the numbers at Adena to show that we are indeed making those improvements. Thanks for coming in, helping to explain all of that.
Thank you. Really enjoyed it.
Again, our special edition guest today at Litter Media has been Chief Clinical Officer Dr. Shaheed Koury of the Adena Health System, and the wonderful new facility. If you've not been out there for a number of years, I know from time to time they have open houses. Maybe you'll get a chance to go out and see it then, their emergency department at Adena. For Litter Media, I'm Mike Smith.